Now I am going to discuss a few echocardiograms in aortic stenosis. First we will see 2D echo. Along with it there will be a color Doppler display as well and a Doppler echo in aortic stenosis. We will also discuss something about low flow, low gradient aortic stenosis. This is an echocardiogram in the parasternal long axis view. Obviously, it is a poor echo window as occurs in those with chronic obstructive airway disease. This is the right ventricular outflow region and this is the region of the left ventricular cavity. The interventricular septum is not clearly seen, but you know it is here. And this is the anterior wall of the aorta, posterior wall of the aorta. Mitral leaflets are hardly seen in this image. This is the left atrium. The right coronary cusp is grossly thickened and also calcified partly. This is the non-coronary cusp. Left coronary cusp is not usually seen in this parasternal long axis view. So you can see that the aortic leaflets are doming. The separation between the leaflets in systole is less, suggesting aortic stenosis. This is the color Doppler showing an eccentric jet. You can see a multicolored mosaic jet. Multicolored is because there is variance in the velocity. Velocity is not uniform at all regions. This is the aortic stenosis jet. This is the color bar where you see the Nyquist limit of 61.6 centimeters per second. When the velocity exceeds the Nyquist limit, there is color wraparound, and when there is irregularities in velocity, multiple regions having different velocity, then you see the multicolored mosaic jet indicating variance in velocities. This is a Doppler echocardiogram taking the gradient from the apical 5-chamber view by continuous wave Doppler. This is the aorta, left ventricle, right atrium, left atrium. The gradient is not very high, it's only, peak gradient is only 29 millimeters of mercury and the mean gradient is 17 millimeters of mercury. But while assessing severity of aortic stenosis by Doppler echo, you have to think about the cardiac output. If the cardiac output is low, even in severe aortic stenosis, gradient can be low. There is a condition known as low flow, low gradient severe aortic stenosis. So before saying that this is not severe, you should assess the aortic valve area by continuity equation, which will give you the aortic valve area and severity of aortic stenosis. When there is severe left ventricular dysfunction, the contraction will not be sufficient enough to produce a good gradient. That is a fallacy of assessing severity of aortic stenosis by gradients alone.